one thing that I wanted to touch base. I'm gonna skip that question because I think, well, I'll ask it just because I'm curious. Because you told me that you had like a $25,000 chiropractic table. I was like, I don't understand. It's just a bunch of padding and metal.
Sure.
Why is it $25,000? What makes one chiropractic table better or different than another one?
Well, that's a great question because number one, the chiropractor is the most important part of the equation. But um, the table that I use is called the Ultimate Table, and I've been using these tables from this company for 30 years. Pardon me. When I was in chiropractic school at Life College, Lloyd Table Company, which was a table company started by a doctor who was also a mechanical engineer. He devised a table that could actually stretch the human body by securing it also and stretching it to take tension off. And actually, that was kind of like the first style of decompression. Because we're decompressing tissue. Now, decompression in and of itself is totally different, but the table that I utilize is a table that stretches the patient out, and I'm able to move their lumbopelvic and lumbosacral region in side flexion and forward flexion and extension, so that I start taking pressure off the facet joints, which are the movable joints of the spine. It helps take pressure off tissues that may be experiencing some impingement or some issues. And all of my patients, when they experience it for the first time, they're like, whoa, it hurts, but it's a good hurt. It's like a good stretch, like you're being stretched out and pulled. I mean, I did it to you the other day. That
Yeah.
was the first time. Like you said, you've been to dozen chiropractors.
Yeah.
No one's ever done that to you before, right?
No, no, no. It
So
was,
this table allows me, number one, I have, the folks can't see it, but we've got 4 tables right here that are our therapy tables. And most chiropractors use these tables, and there's nothing wrong with them. I mean, they're $700 to $2,500 tables, and most chiropractors use these to adjust patients on. But when I have a patient that needs what I feel is a little bit more, when I have a patient that can't go down on a table because they're in so much pain, my table stands up like this. So they just have to come up and stand up against the table, and the table will come down nice and down for them. Then my table comes up at different levels for me to address everything from a physics minded angle of attack. When I make my move, it's so important that my mechanical engineering and my physics background, for me to get the nice, clean, accurate adjustment, that I'm in the proper position. This table allows me to do that. It allows me to stretch them. It allows me to balance out weight. I also can do what's called drop table. It has movable segments that move in different ways. So what it does is it makes me a better chiropractor to get the best result that I can for my patient. Just like a race car driver needs a really strong engine and a team to put this car to the finish line, I demand that of myself for the benefit of my patients. How was that for an answer?
I think that's good. Well said. I think that's a unique thing where the table goes up to meet where the person's at
Right.
in pain.
And then bring them back when I'm done,
Yeah.
so that they can get off. And most of the time it's like, whoa, first of all, I've never had a table like that before. People say, I've never seen something like this before. And then they also say, many of them say, I've never felt that before. Nobody's ever done all that to me.
No, no, that was what I'll say is like I've had lower back problems and bulging discs or whatever it was undiagnosed, but through heavy working out
Sure.
and not the best form. And there's been times where I've tried to get on that, bending down to get on a table where I'm completely strapped myself in, like got that waistband around
Right.
and in pain. And it's a hard thing to do that. So I would have really appreciated someone meeting me where I'm at.
Sure. When
And
people are in acute pain, I want to try to help them as much as I can.
yeah, I can see that. That's